He then introduced me to the new surgical robot. I then was really confused why he said robot. Obviously, I thought that maybe a surgeon would need to do my surgery, not a robot.
I am Vinci. Through 4 small openings, I let the surgeon reach what his hands could not. No long L-shaped cut, only tiny incisions. Jessica healed faster, scarred less, and the tumor was gone.
The future is here now. With the use of the robotic platform, we are now able to perform more and more complex liver surgery by a minimally invasive approach.
I came into King's for a routine checkup, and unfortunately, when I had a CT scan, it was found that I had a lump on my liver. I then went and had an MRI scan, and it was found that there was a growing tumor on my liver. I was living a normal life. I had been into Dubai for 3 years, and I was going about my daily life as normal, and I had no idea that this was in my body. When I came into King's and found out the news that there was a tumor in my liver, I was completely surprised by this and had no idea. I didn't have any symptoms, and Dr. Lisa in King's Hospital then referred me to Dr. Rehan, the top liver specialist here. And when I met with him, he quickly decided that I should have this tumor removed. He then spoke to me about potential surgery options, and I was really nervous because I thought I was going to have a big L-shaped cut on my stomach. However, he then introduced me to the new surgical robot that is now used at King's Hospital.
So Jessica is a young school teacher who came to see us because she had a tumor in her liver. The difficulty with her was that this tumor was in the caudate lobe of the liver. This is one of the most difficult locations to access because it's deep inside the abdomen, and it is in very close proximity to a very major blood vessel, which is the inferior vena cava. So traditionally, these sort of operations were done by the open approach. Now, with the use of the robotic platform, we were able to perform a minimally invasive operation to remove the caudate lobe of the liver, which had the tumor.
I then was really confused why he said robot. Obviously, I thought that maybe a surgeon would need to do my surgery, not a robot. However, when I went home and started looking this up, I was absolutely amazed that a robot could help and cure this inside me. After several weeks of discussing this with my family who are back in the UK, I decided to go ahead with the surgery under the care of Dr. Rehan, and I was putting my whole trust in him and the team here at King's to ensure that this tumor was removed safely. And then when I came in for the surgery, and when you're signing your consent to go into such a major surgery, it's like you're trusting the whole team to make you better again and make you well. But even going into the surgery room and looking at the robot, I still didn't quite believe what I was about to go through.
With the use of new technology and new platforms, we now have the ability to incorporate all the preoperative imaging onto your surgical robotic platform so that you can actually do a virtual surgical procedure before you actually operate on the patient and anticipate what are the problems and challenges that you can face or you're likely to face, and then deal with them in a much more effective manner, making the whole process much safer for the patient. But now with the use of the robotic platform, we were able to offer Jessica a minimally invasive operation, which means that by using the robot, she could have this tumor removed from the liver by a minimally invasive approach with only small incisions on her abdomen.
And waking up in the ICU and not knowing what had happened for the last 6 hours, it was really scary. However, when I had spoken to Dr. Rehan and heard that the surgery went exceptionally well and they managed to remove the tumour, I felt reassured. The next 7 days were really hard in the King's Hospital because I wasn't able to move around. I was bedbound for 3 days. However, the physios then got me up and moving and helped me to shower and start continuing my daily life again. However, I was then sent home and I was able to care for myself from then onwards after just a week. And that is because I didn't have to have an L-shaped cut. I was so lucky that I was able to have the robot, which was less invasive and less cuts on my stomach. Therefore, I was able to start walking around and start doing my daily life again. I then came in and saw Dr. Rehan for follow-up, and he was so happy with how my cuts looked and how I was healing. And within just 3 weeks, I was back to my normal life in Dubai as a teacher.
Now that she has had her surgery and the tumor has been removed, we have histology that shows that this is a completely benign tumor, which is a follicular nodular hyperplasia. So the outlook for her is extremely good. The tumor has been removed. She has recovered completely and back to her normal day-to-day activities, and this would not be of any concern for her future daily activities or her health.
Now, looking back and knowing more about the surgery and how major it was, knowing that I could have had a much bigger cut, the recovery would have been so much longer. But this robotic technology was just incredible, and I have hardly any scarring. The post-operative care that I received here at King's was absolutely exceptional, and I am so grateful every day that I had the surgery done under the care of the team here, and my life now has returned back to normal.
Don't stop believing.